Thank you very much. So I'm Dan Bennett from USC. This is a paper that's a collaboration with my colleagues at USC, as well as Manuela Angelucci from University of Texas at Austin. And we use the COVID panel from USC to study the impact of the COVID-19 economic shock on employment and health for people who work remotely and don't work remotely. And so the premise here is that people who have jobs that allow them to work remotely have more flexibility in the context of kind of social distancing policies and closures of non-essential businesses that happened during March and subsequently in the United States. And so we may see larger impacts of these policies on the workers who don't have the flexibility to work remotely. Those types of workers are generally lower socioeconomic status. And so this shock may increase inequality. And then we are looking to highlight the stark trade-off that non-remote workers have between employment and health, where for people who must work in outside of their home, that they have this trade-off of I can either work and expose myself to greater COVID-19 risk, or I can stay home and lose my job. We use the panel that you've probably heard about already, which started in March of 2020 and has bi-weekly survey rounds. The panel is still ongoing, but we stopped this analysis in mid-July. So everything I'm talking about is through the middle of July. We study impacts on employment, their perceptions of COVID-19 infection risk, respiratory symptoms, and protective behaviors. And given the limited time, I'm going to just not discuss everything that's in the paper. We measure job type or work, whether you can work remotely or non-remotely, based on a question that we asked initially in March before there was a large employment shock, which was, do you have the type of job that allows you to work remotely? And so this is, I think, getting at an issue that Ellen touched on, which is that some jobs maybe you didn't previously work remotely, but you had that capability, and so now you can. And so like if you were to measure remote work just based on whether they actually worked remotely in January or before that, then you would get a different set of people than the people who say they have the potential to work remotely, which is what we do. And so we look at impacts over time for these different groups on health and employment. And then we ask a question of what is the impact of the statewide reopenings that we saw in April and May, where they attempted to lift non-essential business closures. So this is the aggregate impact on employment. And so you see, and I guess to be clear, the way I've labeled it here, round 5 is that period in March before there was a large shocks. We see going back to these rounds 1 through 4 are the quarters 1 through 4 of 2019. And so you don't see impacts on employment before that, but then there's just this tremendous drop off where something like 12% of people lost their jobs across the entire population, including people who don't work, retirees, et cetera. These estimates are comparable to BLS official statistics and CPS estimates, and so we feel confident that these kind of represent the aggregate impact on the economy. When you look by job type, you see a really stark difference, where here's a similar graph for people who worked remotely and who didn't work remotely, as defined by the variable I mentioned in round 5 or March of 2020. So you see everybody had to be employed by definition in that round. But so if you look at this, you see that the people who work non-remotely, their employment fell by about 24% over just the course of a couple of weeks, whereas the remote workers, their employment fell much less. And then you see that the non-remote employment gradually came back somewhat, but still is nowhere near what it used to be for these non-remote workers. So then, who are the non-remote workers? They are lower socioeconomic status. this is just this graph here is the cumulative density of household income measured before COVID-19 for these two groups of workers, and you see that the remote workers are generally wealthier. They are much more likely to have a college degree. They are somewhat more likely to be kind of white or other, which I interpret to be Asian American, and less likely to be African American or Hispanic. So the kind of socioeconomic status differences that you might expect do bear out. And so we compare this impact by remote versus non-remote to impacts by gender, impacts by education, and for the most part, aside from a differential effect that we see for African Americans, the impacts by remote versus non-remote are larger and statistically significantly larger than impacts for women, non-college graduates, or Hispanics. Other work that I'll just mention that's in this paper, but not I won't talk about it in detail, is that we see increases in respiratory symptoms for non-remote workers and increases in perceived COVID-19 risk in the period after COVID-19 began, and that we see that non-remote workers practice fewer work-related protective behaviors. So that this kind of gives you a mechanism for it. They can't protect themselves at work in the same way that remote workers can. When you look by household income and remote or non-remote status, you see that like non-remote workers from the poorest households, 40% of them lost their jobs, compared to remote workers from the richest households, it's something like 5% or less lost their jobs in this shock. So just briefly, is the reopening an effective policy response? We can look at employment before and after states chose to reopen, and what we essentially see is that there is a somewhat of an impact on employment for the non-remote workers. And just look at the bottom graph here, and what I've kind of cut it between states that reopened early and states that reopened late. And here you see in this period, which is approximately in May, that there's like a little bit of a bump in employment for the non-remote workers. But then it kind of converges back in the early states, and then it converges to being similar in both states over in subsequent periods. There's also a health impact that potentially goes along with this. So here, look at this upper right graph and look at the percent of symptoms that people are saying that they have, and you see an increase in non-remote workers saying that they have additional respiratory symptoms. So potentially this is a double-edged sword for these types of workers. Just to conclude, we're seeing that there's this large differential impact on employment in particular, and in addition on health for non-remote workers. And these workers face a stark trade-off between employment and health. These policies that were pursued to try to improve employment for these workers may appear to have improved employment modestly, but at the cost of health for these people. So thank you very much.